pandemic? Well, we've talked a lot about COVID-19 and the protocols in place at schools to protect against the virus and its variants. But there are a number of other illnesses that your child could come down with, and health experts say those viruses could be even more problematic this year. Last year, many respiratory illnesses like the flu and the common cold took a back seat to the coronavirus. Health officials saying back in March that the previous flu season was minimal compared to other years, likely thanks to increased protective measures and also distance learning.
Fall is coming, and that's when you usually see a lot more respiratory diseases, crop up. So it's just going to be something that we're going to have to just kind of wait and see.
With school back in session and in person, though, health experts say we're likely to see an increase in seasonal respiratory illnesses. And while these illnesses aren't especially dangerous for school-aged children, they can be problematic to younger siblings or older relatives.
With the mask requirement for schools and children in schools, hopefully that will help to decrease some of those normal illnesses that we see in children, those respiratory illnesses. But again, it's unknown at this point.
According to the CDC, as the government began easing COVID-19 precautions, cases of respiratory viruses began rising, especially in recent weeks from April to July. And because flu vaccines are generally based on influenza streams that circulated in the previous season, there are some concerns that the flu vaccine may not be as effective this coming season. So as kids return to school, it's important to not only monitor for COVID symptoms, but all respiratory diseases.
The kids being again more social, getting out in the neighborhoods, we're definitely spreading that.
And make sure kids understand what they should be doing at school to keep themselves safe.
I think most of us feel pretty comfortable, especially if they continue to mask. But, with children, masking and making sure they don't cross-contaminate is very, very difficult. And it could actually cause more trouble.
So while you prepare your kids to return to school, health experts are urging parents to remind them to wash their hands often, keep their masks on when indoors and around others, and monitor their symptoms. And if they start coughing or sneezing, even if it's not COVID-19, they should still stay home until they recover. Live in Northeast Bakersfield, I'm Veronica Morley, 23 ABC, connecting you.